question here, in which scenario should the nurse hold the prescription medication and question arise to the administration? So there are 5 patient or 5 information for the patient. When you ready to give the medication, what are the danger or what are the question you have to clear first? Safety is the most important, right? So we have to hold, ask the healthcare provider, then continue. So the client on IV heparin and platelet count is 50,000. So heparin is an anticoagulant, right? So if you give the heparin, we must check patient have any bleeding tendency or yes or no, or patient need any kind of major surgical operation next day, yes or no, or heparin causes the potential complication, and that is heparin induced thrombocytopenia. So if the patient have a heparin induced thrombocytopenia, we do not continue it, right? We have to stop, because the normal platelet count is not the 50,000. It is 200,000 to 400,000. We have to stop, hold, and ask the healthcare provider, should I give or not? So one is the choice. Client on newly prescribed Lisinopril, right? And 8-week pregnant. So Lisinopril is a antihypertensive medication. So it is angiotensin converting enzyme inhibitor, like enalapril, lisinopril, ramipril, captopril. But always make sure my patient are not pregnant. So contraindicated in pregnancy, because lisinopril can cause teratogenicity to the baby, right? Especially the first few trimesters gestation period. Okay, so it is the question, we have to hold it to go next level, right? So so it is the also 2 is also the choice. The client on nitroglycerin patch to heart failure and blood pressure is 84 to 56. So nitroglycerin is a vasodilator, right? So if patient have any problem, definitely, like postural hypotension or blood pressure drop, so what we have to do? Because the nitroglycerin relaxes the smooth muscle in the blood vessel, they have a common side effect, hypotension, like nitroprusside, nitroglycerin, monosorbate, isosorbate mononitrate, or isosorbate dinitrate. They can cause hypotension. It is a side effect. So we have to hold it, right? So it is another option. Number 4, the client on phenytoin for epilepsy. So phenytoin Other name is called dilantin. It is the anticonvulsant or antipsychotic medication, sometimes used for seizure or anxiety disorder. But you see, nurse noted gingival hyperplasia. The phenytoin common side effect is gingival hyperplasia, or they can cause hypoglycemia, discolor of urine, dizziness, and nervousness. So if it is a known cause of side effect, there are no reason we have to stop it. You can explain to your patient, you educate your patient, and if we know this is a common side effect, we do not need to stop. We have to observe it. So it is not a question answer. Client on warfarin and prothrombin time is or international normalized ratio is 1.5 control below. So warfarin, other name is called coumadin, is the anticoagulant, prevent the conversion of prothrombin to thrombin, and right, it's a blood thinner. They can cause the bleeding. They can cause thrombocytopenia. So we have to monitor the prothrombin time, and international normalized ratio is called INR, right? But INR, if 1.5 times control, it is a normal, nothing abnormal. We do not need to stop. We could continue. So it is not answer as well, because it is okay. So let me read their explanation a little bit more about the heparin. Heparin is a natural anticoagulant. It is the risk of heparin-induced thrombocytopenia, also known as heparin-associated thrombocytopenia. Normal platelet range is 150 or 200,000 to 400,000. So in the question we found 50,000. So patient develop thrombocytopenia, means total number of platelet is less than the normal range. And this thrombocytopenia develop as a common side effect of anticoagulant used the heparin. A mild lowering of platelet may occur and resolve spontaneously around the 4th day of administration. The danger is type 2 heparin-induced thrombocytopenia, right? So what are the other side effects, like bleeding, nausea, or hemorrhage? Hemorrhage is most important, right? So if you patient under anticoagulant, we monitor the complete blood count, because at the risk of heparin-induced thrombocytopenia. Educate your patient to monitor the sign of bleeding, right? And also, I said there's some kind of food is good to avoid if our patient under taking this medication. Also keep in mind, be careful, some herbal medication can interfere with anticoagulant. So also educate your patient to stop taking anticoagulant 2 weeks before any major surgical operation. And also frequent blood draw will be needed during the initiation of the treatment. Especially the anticoagulant coumadin, limit the food like cabbage or green leafy vegetables. Also, it is good to avoid caffeine and alcohol. What next? Another medication, angiotensin converting enzyme inhibitor. It is the antihypertensive medication, right? So, such as lisinopril or ramipril or captopril, benzapril, common drugs, but all of them are teratogenic. Lisinopril can cause embryonic or fetal developmental abnormalities like cardiovascular and central nerve system defect, especially during the first 30 weeks of pregnancy. SC inhibitor interfere with the fetal renal hemodynamics. So it is also not good for the kidney, right? Like they can cause low fetal urine output, we called oligohydramnions, and also fetal growth restriction. The all angiotensin converting enzyme inhibitor has a common side effect of dry cough, also palpitation, orthostatic hypotension, or renal impairment. They increase the potassium level. And NCLEX board asks a common question. The lisinopril or enalapril or captopril or all angiotensin converting enzyme inhibitor is a common side effect is angioedema or anaphylatic reaction called Stevens-Johnson syndrome. So what you could educate your patient, tell them monitor blood pressure regularly, BUN and creatinine important to check, electrolyte important to check, and also what is related to for this question, contraindicated to the pregnant mother, right? Okay. But what is the major important or NCLEX board asks the question, I want to tell one more time, the patient who have to take the SC inhibitor, if the patient with hyperkalemia or angioedema, they have to avoid potassium supplement, basically. Now, let me go a little bit about here. Nitroglycerin causes vasodilation and lower the blood pressure, right? But if the systemic blood pressure too low, you must stop it, right? So also nitroglycerin better to take with food, or so when you say another question and NCLEX board asks about the nitroglycerin, protect them from the light. And nitroglycerin or nitrostate better to give sublingually and do not swallow whole tablet. Good information for NCLEX board, right? And also I said phenytoin, other name is dilantin, antipsychotic, anti-anxiolytics, anti-seizure, they can cause gingival hyperplasia. So it is a known common side effect, right? You have to educate your patient. And if we are aware about that, that is good. No need to stop. Warfarin, already we discussed. Let me read the educational objectives. Heparin should be hold when there is a significant thrombocytopenia. Angiotensin converting enzyme inhibit are not administered to the pregnant mother. Nitrate are not admin when the client is a hypotension. Prothrombin time and international normalized ratio is expected to be 1.5 to 2.5, right? So the time of the control below when therapeutic effects are reached. And gingival hyperplasia is a side effect of phenytoin or dilantin administration and is not the reason to stop because the known side effect. So the question here, the parents of a child diagnosed with attention deficit hyperactivity disorder, it is shortly called ADHD, and predominantly inattentive type, and say the nurse, I hate the idea of my child taking the drugs that is stimulant. How will I know that the methylphenidate can work or not? What are the best options? So if patient is diagnosed by attention deficit hyperactivity disorder and patient is treated by the stimulant called methylphenidate. So parents ask, this drugs is work or not? How I can understand, right? There are 4 options. So methylphenidate is generally a safe and effective drugs for the child with ADHD. It is okay, it is the right information, but it does not indicate the response of medication. Methylphenidate will increase the level of neurotransmitter in your child brain. So the mother do not ask the question how drugs work. They want to know the response, drugs working or not. It is not answer as well. You should see your child's school grade will improve, but it will take time longer, right? Secondary effect. Out of 4, the number 4 said your child should be able to more easily complete the school assignment and other tasks. It is the immediate response. You can answer this question if you know what is attention deficit hyperactivity disorder or ADHD. So ADHD is a condition characterized by inattention. What does it mean? they have a difficulty to paying the attention or difficult of focusing. They are hyperactive, means inability to sit still, and also impulsiveness. Impulsiveness means acting without regard to consequence. The ADHD patient has increased the risks for injuries, right? It is very important when you deal with the ADHD patient. So always keep in mind, use the claim and firm approach and set the clear limit for behavior and consequence for unacceptable behavior. So we will incorporate the physical activity to help the child use their energy and provide the safe environment, means remove the unnecessary equipment from the child environment. Also give positive feedback when the child complete a task, and also we will decrease the distraction during their meal time. Important. So if the patient has a ADHD, we treat by stimulant we call methyl phenidate. This is the medication. Or sometimes we use amphetamine. Let me read their explanation first. So, although methylphenidate or amphetamine is classified as a stimulant, the child with ADHD, it improves attention, decreases the distractibilities, and helps to maintain the focus on activities, and also improve the listening skill. For many years, the effect of methylphenidate in the children were labeled as a paradoxical. Now, the scientific research agree with you that methylphenidate significantly increase the level of dopamine in the central nervous system, and that lead to stimulation of the inhibitory system of central nervous system. Methylphenidate works quickly, and symptom relief is often seen after the first dose, right? So what are the educational objectives? The therapeutic effect of methylphenidate can observe very quickly in the children with ADHD. Keep in mind, ADHD and autism is not same. Autism is a genetic neurodevelopmental disorder that affect the individual's ability to communicate and interact with other people. It is the ability range from highly functional to poor functional. Usually, autism patient has a lack of eye contact or repetitive action. Also, strict observation of routine or language delay, sleep disorder, also digestive problem. Sometimes they have allergic as well, right? So methylphenidate improve attention, decrease distractibilities, help maintain the focus on an activity, and improve the listening skill. Question here. A client diagnosed with schizophrenia, and that is resistant to the other antipsychotic medication. So if any disease like schizophrenia is resistant to the typical medication, definitely we will give them atypical medication, right? So which of the medication? Atypical medication started by Clozapine. It is the Clozapine is an atypical antipsychotic. Which of these periodic measurement has the highest priorities for this client? So there are 4 options. Which one the most important? And your patient diagnosed by schizophrenia, right? So schizophrenia is a psychotic disorder, and patient has a psychotic thinking and behavior, usually more than 6 months, and functioning and relationships significantly impaired, right? Some patient present with delusion or hallucination or illusion, right? And even sometimes some of the patient has disrupted affect, whatever it is. The patient definitely you try for psychotic medication, right? If the psychotic medication does not work or antipsychotic medication does not work, we give them atypical antipsychotic. The atypical antipsychotic are also known as second generation antipsychotic. Usually, atypical antipsychotic are Clozapine or Risperidol or Olazapine, right? Or Aripiprazole. All of them are atypical antipsychotic. So this patient treated by atypical antipsychotic. The atypical antipsychotic including Clozapine, Risperidol, Olazapine, and Aripiprazole. So when you give this medication, you have to keep it mind some very basic information, because atypical antipsychotic can cause some side effect. Keep in mind, the good news of atypical antipsychotic have a fewer extrapyramidal side effect. Bad news, atypical antipsychotic have some major side effect, like they can cause hyperglycemia, or they can develop diabetic mellitus type 2. They can cause dyslipidemia, and also they can cause weight gain. But the most important, they can cause agranulocytosis. So there are four options: the complete blood count or CBC, absolute neutrophil count, highest priority. This is the highest priority because atypical antipsychotic can cause agranulocytosis. So low WBC count. When the low WBC count, especially neutrophil, infection easily catch up, right? So if you give the atypical antipsychotic or clozapine or risperidone or olanzapine or aripiprazole, and if they have agranulocytosis, they will complain of fever, body ache, chill, and sore throat. Basically, the sign of flu. This medication must be stopped immediately. This is very serious condition. Second is electrocardiography, fasting blood sugar, and fasting lipid. So I said atypical antipsychotic can cause dyslipidemia, can cause hyperglycemia. You can check it, but agranulocytosis is most important. So complete blood count is the highest priorities. Number 4, weight, height, and risk circumstances. You can measure, but not the first priorities. And let me read it. Clozapine is an atypical antipsychotic. Not only clozapine, risperidone, olanzapine, aripiprazole. So what I'm going to read it, it is also same for risperidone, olanzapine, or aripiprazole. Common niche character. So all atypical antipsychotic medication used to treat schizophrenia that are not responsible to standard or typical antipsychotic drugs or first generation antipsychotic drugs. Clozapine associated with the risks of agranulocytosis, right? Means low WBC count. Therefore, usually only the client with the treatment resistant schizophrenia. The client must have a white blood cell count more than 3,500. What are the normal count of WBC? It is 4 to 11,000 per cubic millimeter of blood. And also the neutrophil count must be more than 2,000 before starting the clozapine, right? So it is the most important, the first obtain the baseline complete blood count and neutrophil count. Agranulocytosis is reversible if you catch up very early. Therefore, the client taking the clozapine must have their WBC and neutrophil monitored regularly throughout the treatment or therapy, right? So the client should also contact the healthcare provider immediately if they develop the fever, body ache, or sore throat, right? So let me read what are the other complications of these groups of medication. What are the other complications? So atypical antipsychotic can cause weight gain, can cause hyperglycemia, can cause dyslipidemia. So weight gain, a baseline height, weight, and risk circumstance should be obtained, and also calculate the body mass index, shortly called BMI. Hyperglycemia, or patient develop diabetic mellitus type 2. Symptoms of hyperglycemia include the thirstiness, urination, means polyphagia, polydipsia, and weakness. Increase the blood glucose level should be monitored, and also dyslipidemia. So a lipid profile should be obtained. So this is a common side effect, right? Agranulocytosis, which is the most important for my patient, because infection easily catch up and patient present with you with a flu-like symptom is the most serious adverse effect of clozapine. The pre-treatment assessment and ongoing monitoring of WBC and neutrophil count are necessary. The client are advised to contact their healthcare provider if fever or sore throat develop. Clozapine can also cause metabolic syndrome, right? What is metabolic syndrome? When any patient have a 3 symptom like weight gain, like hyperlipidemia or dyslipidemia, and hyperglycemia or type 2 diabetes. When a patient with these 3 symptoms together, we called metabolic syndrome. And also patient chance to develop involuntary movement of muscle, we called seizure, right? So if we see anything this, what are the nursing action? We have to stop the medication as early, right? And also we have to inform the healthcare provider. So nursing prioritization or interaction is we have to stop it and inform the healthcare provider.